Hi, my name is Jeff. Unfortunately, I haven't had an opportunity to date to use ultrasound for PIVC insertion. The reason because there was only one trainer who can do this, and also the lack of proper ultrasound machine suitable for PIVC insertion. And also, our nurse unit manager in our department wants to make sure that we develop a proper protocol for us to be able to utilize ultrasound guided PIVC insertion. I was excited at first that I will be able to practice this skill in our facility. And I am very good at IVC insertions, and I felt confident as well when we were doing practice sessions in the workshop, that I'll be able to do it given the right time and the right place. But like what I said earlier, my mom wants it to be a seamless transition, um, and also the for us to give a budget to get a proper ultrasound for IVC insertion, um, we need to do proper protocol so that we will be allowed to have a budget to be able to obtain the ultrasound machine. I don't understand, but I still practice all the concepts that I have learned in the workshop. Like before, I thought that you can just insert in any vein that you see, as long as it works. But now I make sure that I follow the 3 R's of IVC insertion, which is the right patient, right vessel, and right line. I even shared it with my colleagues, and they were at awe of the information. And we ensure that we follow the guidelines to provide quality of care to the patients. It was also amazing that that in every size of vein, there's an equivalent size of catheter that should be used to for it to be able to work and to be able um, to save the vein, like the vein patency, like the care of the vein, so that it can be used again. And also, what I'm amazed of is especially the EGFR, that you have to check the EGFR. If the EGFR is high, you can't use the cephalic vein. I am not aware of that, but now I try to practice if there's a recent labs available in the patient's profile. I try to check it first, and and if the EGFR is high, I try to avoid the cephalic vein, and I try not to do multiple attempts. Before, I I do blind shots, but when I did this workshop, I I tried to avoid it. If I try to refer it straight away to the people who are trained to do IVC insertions, but unfortunately they're in a different department and they can't just go down to us. And then if not, if they really require a CVAD line, I talk to the doctors, consultants, or CNCs and tell the patient that for things to be easy, seamless, and less painful, they need to really have a CVAD or IVC insertion via ultrasound in another department. Yeah, and even though I didn't get to practice ultrasound guided IVC due to the lack of equipment and assessors, I know it's just a matter of paperwork. Like my NOMS and the leadership team will formulate a policy for this one. And once it's done, I am very confident that this procedure will be seamless, and it will be an added repertoire in our department. And I'm sure patients will be happier, more confident in our service because um, they won't be able, they don't have multiple attempts will be less in doing IV cannula, and it's easier now because we can be more accurate and we can save the veins of our patient. Um, yeah, unfortunately, at the moment, the implications will fall on the wait times. That's what we're trying to solve in our department. The wait times in getting blood, inserting cannulas for the patient will be longer. We are a cancer institution, so we know that cancer patients has very difficult veins, and if we had the opportunity to do the IV cannula, it would be faster because we will be more accurate, and we won't have to refer the patient to other departments. Um, and also the problem will also turn would be it can cause major delays. Unfortunately, if we can't find the patient's veins, we do multiple attempts, and once we've done 3 attempts, we'd have to refer them our to the doctors or to the imaging department, and it might cause grief to the patient and anxiety as well, and unnecessary pain because of the multiple attempts. And yeah, that will be the major implication for this one. But generally, our institution is really good in applying new procedures to improve patient care. It's just a matter of obtaining the equipments and creating a policy for this for this thing to be seamless. Well, at the moment, we do what we can to be ready in applying ultrasound IV cannulation. We share to our colleagues the information that we learned in the workshop, and everyone is willing to learn and participate. Like I said earlier, they were amazed, and all we want to do is to give optimum care to the patient. And now we're that aware, we try to practice it, and we also tell the patient, we also educate them about the vein about the vein care. Try to educate them as much as possible. And my action plan for further education and training opportunity in ultrasound guided PIVC is to start to print the guidelines and post it in the rooms of our patient pathology. And I also copied some of the guidelines, like the measurements, especially the measurements for the catheter, certain measurements. Unfortunately, we couldn't apply it because we don't have the ultrasound, but I'm but at least the staff has an idea that these certain cannulas need space for it to move, and then for the vein to be inserted in a certain vein, for it to be taken care of, and for it to be functional and last longer. Um, yeah, and even though we don't use ultrasound guided PIVC at the moment, everyone has to know how to and select the proper veins and which device to use. I would also recommend to many colleagues to attend this workshop because it is very, very vital to our career and patient care. And I'm very, very lucky to have attended this, and I have learned really, really learned a lot. And I'm very passionate for me to be able to practice this, hopefully one day, hopefully soon, and it's available. But at the moment, we do what we can. I try to practice it with the what available ultrasound machine in our department, just to be familiar with the scale, and I won't forget how to classify veins from arteries and capillaries. Thank you.